Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, March the 24th, 2021. We are in week 55 of the COVID pandemic here in Montgomery County, and I am joined today by our Vice Chair, Commissioner Ken Lawrence. First, I'd like to start with an update on our vaccination efforts. Our 3 mass vaccination clinics remain on track with first and second doses. The Montgomery County Office of Public Health continues to receive all necessary second doses, and our first dose clinics are running smoothly, administering the Pfizer vaccine. I do want to note that while we have opened 3 locations for the convenience of our residents, we are allocating only slightly more vaccine doses across those 3 sites. So for those of you that have noticed that our sites are not full, you are correct. We have significantly more capacity to administer vaccine than we have doses to give. We certainly hope that this will improve in the future. The Pennsylvania Department of Health has confirmed that over the next 4 weeks, we will continue to receive at least 5,850 doses of the Pfizer vaccine for our first dose clinics. We continue to communicate to the Pennsylvania Department of Health that we have the capacity to administer higher quantities of vaccine. We are hopeful that our vaccine supply will continue to grow in the coming weeks, as we still have a number of people on our 1A list. This week, the Pennsylvania Department of Health amended the existing universal face coverings order to align with the Center for Disease Control's recommendations for fully vaccinated people. And I thought it would be helpful to go over those recommendations today, particularly with the upcoming Passover and Easter holidays. According to the CDC, there are several activities that fully vaccinated people can now resume as low risk to themselves, while being mindful of the potential risk of transmitting the virus to others. These activities include visiting with other fully vaccinated people indoors without wearing masks or physical distancing, visiting with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. And you can refrain from quarantine and testing following a known exposure to COVID-19 as long as you are not having any symptoms. However, it is important that even fully vaccinated people continue to take precautions in public. This includes wearing a mask, maintaining social distancing, avoiding crowds and gatherings, getting tested if you experience COVID-19 symptoms, and following travel requirements and recommendations. This guidance is important because, number one, the vaccines are not 100% effective. So if you do start to experience symptoms consistent with COVID-19, you should get tested. And number two, it is still not known the extent to which someone who is vaccinated could spread the virus to others who are not vaccinated. So it's extremely important until we get high percentages of our community vaccinated that everyone continues to follow these masking guidance. As we approach Passover and Easter, I just want to remind everyone to please be as safe as possible. We know some families are making plans to gather. We have seen holiday spikes after all of the recent holidays. We'll be showing you that graph again later today. So we just want to encourage everyone to please follow these guidelines to keep you and your family safe during these holidays. As you'll hear shortly, for the past week, all of our numbers are going the wrong way, including numbers of cases and numbers of hospitalizations. Another reason to stay vigilant is the fact that we continue to see increasing cases of the B.1.1.7 variant in the county. That is the variant known as the UK or British variant. To date, we have 35 confirmed cases. This variant is 50% more contagious and can cause more serious disease. We continue to see it spreading in our community. So we are not out of the woods yet, and we need everyone to continue to work together to stop the spread. And just one more time, we urge you to be very cautious during the upcoming holidays. Celebrate separately if at all possible. And if you are traveling over the spring break time period, please be very, very careful. As I've mentioned in previous briefings, the accurate collection of racial and ethnic data to inform our equitable vaccine distribution strategies is extremely important. I continue to ask our community to join us in this effort to make sure that as vaccine efforts continue, we're reaching all members of our community. Countywide vaccination data compiled by the Pennsylvania Department of Health currently shows an incomplete picture of who has been vaccinated in the southeast section of Pennsylvania and in Montgomery County. This is due to a large percentage of missing data and data that is not broken down by the provider. Race data is available for only 83% of people vaccinated, and ethnicity data is present for only 69% of people vaccinated on the Pennsylvania Department of Health dashboard. To ensure access for all people, we have deployed specific strategies to reach underserved and underrepresented communities, which include holding vaccination events with members of the Black, Asian American Pacific Islander, and low-income senior communities to bring the vaccine directly to their community hubs through partnerships with county hospitals and pharmacies. The county has launched a mobile vaccination unit to reach seniors living in congregate care facilities who would otherwise be unable to get to a county-run mass vaccination site. We've implemented phone registration that includes access to Language Line and a choice of 120 different languages. The county is also offering 3 different modes of no-cost transportation to each of our vaccination sites. In addition, we have held multiple virtual vaccine town halls and developed educational materials in multiple languages in coordination with trusted community leaders to address issues of vaccine hesitancy and to provide information on the vaccine rollout. These town halls have been attended by over 1,000 people and viewed more than 40,000 times on demand. We continue to ask our community to fully fill out their vaccination record, and please self-identify your race and your ethnicity so that we can actually accurately capture this important information. This will go a long way to ensure that we don't leave any members of our community behind in our vaccination effort. Pre-registration for the COVID-19 vaccine remains available by phone through our COVID-19 hotline. That number is 833-875-3967. Our Office of Senior Services has implemented this service for people in the county who need support pre-registering for vaccine appointments by phone. To pre-register for the vaccine by phone, you can call the hotline, and again, that number is 833-875-3967, and just let the agent know you need support in pre-registering for a vaccine appointment. Once your information is in our pre-registration system, it will be placed in line to receive an appointment. When we have vaccine for you, a volunteer will call you back and book you for an appointment slot over the phone. So there's no need for callers to have an email address or internet access. We also want to remind residents that no-cost transportation is available to all vaccine appointments at county-run vaccination sites. There are currently 3 options: Transnet, SEPTA, and GoGo Grandparent, which actually goes live tomorrow, for anyone who needs a ride to their vaccine appointment at a county-run vaccination site. You can simply call those numbers and schedule your transportation. And again, it won't be any cost to you as long as you're going to a county-run vaccination site. So let's give an update on how we're doing. For those of you who have already pre-registered on our site, we continue to send weekly emails to keep you updated on our vaccination progress and what you can expect when it's your turn. We have been working through our individual pre-registration list and continue to vaccinate over 5,000 people a week. We are also cleaning our list and removing people from our list that receive their vaccine elsewhere. As of this morning, we have 89,325 people remaining on our 1A pre-registration list. To date, we have sent 133,484 appointment notifications. So we are making progress on this list. At this time, and depending upon when you registered, it may be up to 10 weeks before you hear back from us about scheduling an appointment with our current rate of supply. Of course, we do hope that is going to improve. To check our progress, you can visit our vaccine page at www.montcopa.org/COVID-19 vaccine and click the link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th. If you know the date you registered, you can see how many people are ahead of you. Currently, we are registering people for vaccine appointments who registered on or before January 31st. The website also now displays a running total of how many doses of vaccine we have received and how many doses we have given. Again, to get to the vaccine page, you can go to www.montcopa.org/COVID-19 vaccine. So on the chart before you, you can get a sense of how things are going. On the top row are the numbers for the Montgomery County Office of Public Health only. We have now, as of yesterday afternoon, received 57,020 first doses. We have given, as of yesterday afternoon, 49,364 first doses. So we have about a little over 7,500 remaining for this next week. And by the time we get our next shipment next Tuesday, we'll be down to about 1,700 doses if all goes well. You can see on the middle box on the left that we still have a little over 89,000 people remaining in our individual 1A list. We do still also have some additional healthcare workers. Some are continuing to sign up with us that are on our business or healthcare provider 1A list. And that we have sent unique tokens to 133,484 people. And we are on January 31st in terms of scheduling. So how are we doing countywide? That's the box in the bottom left. So we are now at 134,282 people who've received one dose of a 2-dose vaccine. We have 84,449 that have either received both doses of Pfizer or Moderna or the single dose of Johnson & Johnson. So we've got 218,731 people who are partially or fully vaccinated. As a percent of our total population, that is 26.32%. And as a percent of the adults that are eligible to receive vaccine, so that means that you're at least 16 years old, we were at 32.49%. So these numbers do continue to go up every week, and we are making slow but steady progress across the county. In terms of countywide race and ethnicity data, you can see the numbers there on the box on the right side. So just to walk you through this, the Asian community makes up 7.7% of the population of the county. This is self-identified data given to the census. And currently we have 0.7% of our vaccinations being received by people who identified as Asian. This is up slightly from last week when it was 0.6. In terms of the Black and African American community, it is 9.6% of our county population. And of the individuals vaccinated, they make up 4.7% of those vaccinated, which is up from 4.4% last week. The white community is 78.8% of the population and is overrepresented in the individuals that have been vaccinated, 86%. And then other or multiple races, 3.9% of the population and 8.6% of those vaccinated. So you can see that we still do have a lot of question marks, 32,989 people who did not identify race, that's about 1 in 6, and 61,683 who did not identify ethnicity, that's 1 in 3. So again, you can see these numbers are substantial, and the more information we have about who's actually been vaccinated, the better our data will be, and the more that we can assure that we're reaching everybody that we need to reach in our community. Moving on to our regular update. Since the March 17th press briefing, we have 967 new cases of COVID-19 reported in Montgomery County for the dates inclusive of March 17th through March the 23rd. This is a daily average of 138.1 cases and brings us to a total of 49,620. These positive cases are a result of a positive test for the virus. No antibody tests in these numbers. 3 of these are from a long-term care facility. 1 is from the Montgomery County Correctional Facility. 20 are from other congregate settings, and 943 are from the community. These positive individuals are from 60 municipalities. As you know, all 62 of our Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 7 months old to 94 years old. And as always, you can check our county maps and other information at montcopa.org/COVID-19. Today, we had 491 females, 470 males, and 6 unknown. I am sorry to confirm that 11 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,255 deaths confirmed positive from COVID-19. These individuals ranged in age from 60 to 93 years old. 8 died at a hospital, 3 died at their residence. Overall, 635 females and 720 males have lost their lives to COVID-19. They ranged in age from 25 years old to 106 years old. In terms of racial breakdown for the individuals who have died from COVID-19, we have 2 American Indian or Alaska Native, 34 Asian, 9 Asian Indian, 6 Asian Korean, 150 African American or Black, 652 white, and 402 unknown. The situation remains stable at the Montgomery County Correctional Facility. All inmates that have tested positive for COVID-19 are in isolation and stable without symptoms. We continue to do routine antigen testing on all correctional officers and others that have contact with inmates. So as I mentioned earlier, our positivity rate has increased during this past week. Our 14-day average positivity rate is 5.21% as of Thursday, March the 18th, compared with 4.83% as of Thursday, March the 11th. And you can see our graph here. The orange squiggly line represents the number of tests conducted on any given day, and the blue line is the 14-day running average of the positive PCR tests. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph shows the daily positivity rates for February the 19th through March the 18th, and it shows that the daily positivity fell below 5% on 12 of those days, but you can see that it is starting to tick back up and has been above 5% on a daily basis for the last couple of days. Our hospitalizations continue to remain high, but have continued to remain high and have actually increased since last Wednesday. Today, 137 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is increased from 110 last week. 7% or 9 of these individuals are requiring a ventilator. This is an increase from 4.5% last week. Our hospitals remain busy. To put this in some context, on October the 21st, there were 24 patients hospitalized with COVID-19 in a Montgomery County hospital. Testing continues to be strong. For the 14-day period ending March the 18th, 36,840 Montgomery County residents were tested. This is an increase of 1,112 people tested compared with the 14-day period ending on March the 11th. And we can move on to our date tested graph. So again, as a reminder, these gray bars are the number of people who were tested on that particular day. The red and the pink lines are the 7-day and 14-day averages of all cases. The dark blue and the light blue are the 7-day and 14-day averages of cases from the community only. And the orange and yellow down at the bottom are the 7 and 14-day averages from our long-term care facilities. Next, we'll zoom in to the last couple of months. And you could see it on the prior graph, this recent uptick that we're seeing in both our 7 and 14-day averages. So again, just please be cautious, particularly as we head into a couple of holidays and people potentially traveling for spring break. We are by no means out of this yet. We continue to have plenty of testing available for anyone who needs or wants to be tested. As I have for months, I encourage you to get tested. Even if you just think you have a funny feeling that you need to be tested, we have plenty of testing. So please get tested. Our testing sites remain open Monday through Friday. We vary the hours at each site each day just to offer flexibility for our constituents. And to register for a test, you can do that online at moncopa.org/COVID-19. Click on the green County Testing Information button, and appointment slots open at 7 a.m. Phone registration is also available for the sites at 610-970-2937 for all of our sites, and that starts at 8:30 in the morning. Just a reminder that we do have language line at that phone number, so there is a choice of 120 languages for anyone who calls in via that phone number. So just a final reminder that this situation remains serious. Our case numbers are actually on their way back up. We are seeing a number of individuals identified as carrying the more contagious British variant of this virus. And while we have made good progress vaccinating people, we still only have about a third of the people in our community vaccinated with either one or both doses. So we have a ways to go before we are approaching anything close to herd immunity, which would offer protection to all of us in the community. We're just not there yet. So in the meantime, you know this drill. People still need to be wearing their masks. You need to be watching your social distancing. If you can work from home, you should continue to do so. You should avoid small social gatherings where people are taking their masks off in private homes. Keep those hands clean. We're so close. We are so close, but we just need everybody to stick with this a little bit longer until we can get a much higher number of people vaccinated. And then we can take some different kinds of steps, but we're not there yet. So with that, I have just one announcement today, which is that we continue to hold vaccine town halls to provide our community with the latest information on the vaccine rollout and answer your questions. Our next virtual town hall is on Tuesday, April the 6th at 1:15. We have partnered with the Montgomery County Immunization Coalition, the Senior Adult Activity Centers of Montgomery County, and our Office of Senior Services for this town hall. To register, you can visit www.montcopa.org/town hall, all one word. Participation is available online through Zoom, via our Facebook page, and you can call in by phone to this town hall if that would be easier. As a reminder, these events are no cost to attend, and a recording will be available following the event. And with that, I will turn over to Commissioner Lawrence.
All right, thank you, Madam Chair. I have a couple of announcements to share today. For those of you who watch these briefings weekly, we'll continue to share this information about these programs until the funds are out. And I would ask people that even if it doesn't benefit you, even if you're not eligible, if you could share this information with businesses or individuals, it would be greatly appreciated. We have our Montco Strong 2021 Hospitality Industry Recovery Program, and this is to help businesses negatively impacted by COVID-19. The county has received $9.4 million from the state to grant to eligible businesses, and we can do that in grants from $5,000 to $50,000. Eligible businesses must have their primary business activity in North American Industry Classification System subsector 721, which is accommodations, or subsector 722, which is food services and drinking places. Interested applicants are strongly advised to review the program guidelines and frequently asked questions to ensure eligibility before applying. Program guidelines and instructions are available in English, Spanish, and Korean. And there's also a 7-minute instructional video, which walks you through the application process and offers tips and suggestions to ensure a complete application. Grants will be awarded on a rolling basis, and the application window will remain open until grant funds are fully allocated. And here's a quick update on the application so far. We've received 267 applications, 37 identified as subsector 21, which is accommodations. The rest identified as subsector 722, which is food services and drinking places. 47 of our municipalities are currently represented. 30% of the applicants have identified as minority-owned businesses. 32% have identified as women-owned businesses. 4% of applicants have identified as veteran-owned businesses. And 90% of the applicants have indicated they've been in operation since 2018. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. And questions regarding the program may be submitted through the Commerce Department's assistance request form on their website at www.montcopa.org/commerce. And due to the large amount of expected applications, feedback on individual applications will not be provided. Next, I'd like to share information about our rent and utility relief program. We know that many people across Montgomery County are still facing job loss and the economic impacts of the coronavirus pandemic. We know that this has put a great strain on renters as they try to remain in their homes and landlords as they try to manage their expenses. And to compound this, the CDC's eviction moratorium is set to expire on March 31st, and the Pennsylvania Public Utilities Commission utility shutoff moratorium will end on April 1st. The Montgomery County Rent and Utility Relief Program, administered by Your Way Home, allows eligible households to receive up to 12 months of assistance for rent and utility bills dating back to March 13th, 2020. Assistance can be for past due rent, utility payments, or future rent payments. Funding for security deposits, first and or last month's rent, is also eligible as part of the program. And there is no financial limit on the amount of assistance a household can receive. $55 million is available for the program in Montgomery County through a combination of state and federal funding. And with this amount of funding, we are aiming to serve between 1,900 and 3,800 households. Eligibility requirements for the rent and utility relief program include the household must reside in Montgomery County. One or more individuals in the household has qualified for unemployment benefits or experienced a reduction in household income, incurred significant cost, or experienced other financial hardship due directly or indirectly to the COVID-19 pandemic. And the household can demonstrate a risk of homelessness or housing instability, and households must be at or below 80% of the area median income at the time of application. To apply, residents are encouraged to call 211 or text their zip code to 898-211. Applications can be done over the phone, in person, emailed, or both. Residents can also reach out to one of these 6 organizations partnering with the county to learn more about the program and apply. And these organizations are CLAMO, Family Services of Montgomery County, Manna on Main Street, WYCA Tri-County Area, CADCOM, the Pottstown Cluster of Religious Communities. And all this information that I've shared can be found online at www.yourwayhome.org/ERUC, or as I mentioned, you can call 211. Anyone who lives in Montgomery County that is struggling to pay their rent or utility bills are encouraged to apply, and we are accepting applications on a rolling basis until all the funds are allocated. That I'll turn it back to you, Madam Chair.
Thank you, Commissioner Lawrence. So with that, I'll just remind everyone that our next virtual briefing will be Wednesday, March the 31st at 1:30 p.m. And I'm happy to take questions. We are both happy to take questions.
Our first reporter this afternoon will be Jim Melward from KYW.
Oh, so many questions, so little time. I guess I'll start with the numbers. You said 89,000, which, if I'm not mistaken, is more than 45,000 fewer on your list, your registration list from a couple weeks ago. If that's correct, does that pace continue? Does it change the estimate of when you might get through 1A?
Last week, we had about 127,000 people on our list, just to give you a sense of where we've come. So this represents two things. One is that some Montgomery County residents do have the means to get in their car and drive lots of different places. We are being told by people they've gone to other states, and they have gone to other communities in this state. So they've received vaccine. And then many people are have put their names on any list that they could. And so we are finding, as we start to go through, that some of the people that we've reached out to have gotten vaccines somewhere else. So happily, we're seeing that list start to come down a little more quickly, which I think is good news. The final piece of the reduction in the numbers is that we are scheduling out a little further in terms of the number of weeks out that we're scheduling, because we have been given assurance that we will get that minimum number of doses for the next 4 weeks. So we are in the process of scheduling out those full 4 weeks. And so that will bring the numbers off that list as well.
And some of the things you mentioned there, especially driving long distances, kind of go into my next question. It's no secret that many reporters on this call have had struggles dealing with communications from the Department of Health. Understanding, not specifically talking about the unused capacity and hoping for more vaccine, but more along the equity and the conversations of the state coming in with Johnson & Johnson to use at their clinic or clinics in the 4-county area. More specifically on the equity standpoint, where does the communication between your Office of Public Health, your Office of Public Safety kind of stand with the Department of Health in really targeting the areas that need to be targeted, the areas that are harder to get into?
Well, our communication has been very clear that number one, we have lots of unused capacity. Number two, that we have asked for Johnson & Johnson vaccine on several occasions, specifically to use for particularly vulnerable populations. For instance, the homebound. It would be to everyone's benefit if we could make one visit to a homebound individual's home rather than having to make 2 visits to that individual's home. We also have individuals experiencing homelessness and others with quite varying job hours, maybe not job hours that aren't set. So if they only had to come to get a vaccine once, it would be so much easier for them. So we have conveyed all of that to the Department of Health and asked to get more Johnson & Johnson vaccine. So far, we've not received any. And as a consequence, we're carrying on. Our mobile vaccine site is making its rounds around the county, and I've listed a number of other steps that we're taking. And we'll do all of that, and we'll do all of that twice, because that's what we have. So we're not going to sit around and wait. We're just continuing on, but we could be so much more efficient if we did have that single dose.
So you've asked for it. You haven't received any. Have you received any communication from the state that could be in the works or in plans going forward?
Only hypothetically, that maybe at some point in the future that we could get it, but nothing definitive.
You don't sound very optimistic.
I don't have any reason to be optimistic.
All right. If there's time, I'd love to ask more questions, but I will yield my remaining time to Chairman Todd.
Thank you, Jim. Next
Todd,
we'll
you
go...
got a promotion there.
Glad to hear it. Next, we'll go to Deanna Durante from NBC 10.
Hello, all. Happy Wednesday. In terms of the changes of vaccine allotment, we're seeing a lot of smaller community hospitals, one that was hoping to partner with the county to get to some of those vulnerable populations, and smaller pharmacies that had directed their efforts at the homebound and the elderly, being told that they didn't vaccinate people fast enough, and now they're losing their allocations. I was curious if you had any idea. I know that you know the numbers solely on your clinics, and that's what you're doing, but if you knew any more numbers of how many pharmacies or hospitals in Montgomery County were affected by that allocation change.
I have the current list of which providers are currently receiving vaccine under this new allocation paradigm. I don't know that I ever saw a complete list of who was getting vaccine previously. So you'd really have to get that from the Department of Health.
We were in one of the smaller pharmacies this morning as they were vaccinating people, using up their last dosages of the first shots of Moderna. And I asked people, well, how many lists were you on waiting? And they said just this one. And I know you had encouraged people to get on multiple lists, but the state also said, don't do that. So now this pharmacy has 10,000 people on its waiting list and isn't going to get any more first doses. Where do those people go? They may not, there may be a lot of them that aren't on your county list or anywhere else.
Yeah. Well, I would certainly urge them to get on the county's list and right away. And hopefully our list is going to move a little faster than it might look if you just look at the raw number of people or the absolute number of people, because we are finding that about 30% of the people that we contact have gotten a vaccine somewhere else or have an appointment to get a vaccine somewhere else. And so they're declining our appointment. So I would certainly continue to urge people to get on our list. They can do that at montcopa.org/COVID-19 vaccine. And of course, there are other pharmacies that are continuing to get vaccine. I believe that many of those pharmacies are also developing their own lists. But I want to make clear that the county does not have any control or input into how these allocation decisions are being made by the Pennsylvania Department of Health.
And that's just an example of why a centralized list would have been ideal from the beginning, so that people wouldn't have to worry about that they signed up at one place and that place is no longer receiving vaccines. So now they have to scramble to get on other lists or the county list.
I don't want to run out my time here, but you open the door on things that would have been helpful from the beginning. In the beginning, the state was saying these masks, we want to send it to these little providers. If they know their community, all these people know their community. We don't see a need to have our own sites and have these mass sites. And now all of a sudden they've flipped and said, this is what we need to do. Wasn't having mass sites run by people like the National Guard something that was in the kind of pandemic playbook from the beginning?
Well, every county has a medical countermeasures plan, and I can only speak to the plan that our county had, but we have effectively executed that plan. We have stood up multiple sites ready to mass vaccinate people. We did not need the National Guard to stand up these sites or to implement our plans, and that is why we have been ready and waiting now for weeks. Because every drill we've ever done, every plan we've ever talked through, this was how it was supposed to go. The county sets up the sites, the state provides the medication, in this case, a vaccine. We're ready to go, and we're still waiting for more vaccine.
One final question. What can you attribute to the uptick in cases? Is it a false sense of security that vaccines are out there? I realize you're not interviewing people when they test positive, but I wasn't sure what maybe contact tracers were hearing or anything like that to try and drive the point home that cases are going up 55 weeks into this.
Yeah, well, I think there's a couple things. I can tell you a little bit about the contact tracing. I don't have the exact numbers in front of me, but the number one exposure is that a family member or household contact is exposed to someone else who has COVID. So that's the number one. But people are getting exposed at work. People are saying that they attended school. Let me rephrase that. In addition to that household contact, people are asked, where have you been in the last 2 weeks, trying to get a sense of where they might have been. And about 20 some percent have been at work. Another 16% or so have been at school, either working at a school or attending a school. Some have been to sports events, particularly some of our younger people, private parties, that sort of thing. So nothing's really changed in terms of what we've seen now for months, is that people are, when they get around people who don't live in their house, if they are not careful, they take off their mask. If they get too close for too long, we see spread of this virus. Nothing has changed yet. Not enough people are vaccinated. It's wonderful that the weather's warm, and I would certainly encourage any holiday meals to be taken outdoors if the weather holds. But, unless people are outdoors doing those things, the risks haven't changed. And if anything, the risk has gone up a little bit because we have these more contagious variants here in the county. So I just think it's a combination of all of that.
Okay, thanks. And like Jim, if there's more time, I may have some more to ask.
Next, we'll go to Bill Anderson from Fox 29. Bill, you appear to still be on mute right now. Okay, for now, we'll move on, and we can always come back to Bill if he gets that figured out. We'll go to Alicia Reed from CBS 3.
Sorry about that. I had a problem unmuting for a second. Commissioner, can you talk to me a little bit about, in the next couple of weeks, how long do we think we'll get to, let's say, people in phase 2 if we have this huge backlog that we're dealing with for phases 1A and B?
Well, it all depends on how much vaccine comes into our region. If the Pennsylvania Department of Health increases our allocation to compensate for this significant backlog of 1A individuals that we have here in the county, we could move through that number fairly quickly. As I've said, we have plenty of capacity to give thousands more doses a week than we're currently getting, or that we currently have vaccine to give. So if the Pennsylvania Department of Health will send us more vaccine, we could move through that pretty quickly. But right now, at our current pace, we are vaccinating a little over 5,000 people a week, about 5,500 people a week. That's all the vaccine that we have.
And so we're at the newest site that opened on Friday in Willow Grove, and there was just a small amount of people that are coming in to get vaccinated. When more sites are being opened, are we just anticipating that at some point the Department of Health will give more vaccine, and you're just preparing to accept those and hand them out as quickly as possible while we're opening more sites with the same amount of vaccine that's available?
Well, we opened the additional site because we wanted to make it more accessible, our sites more accessible to more people. It is a bit of a distance from the area served by the Willow Grove site to the other parts of the county where we have other sites. So we just wanted to get a site open on the eastern part of the county. It's a very highly dense portion of our county. We just wanted to make it a little bit easier for people who live on that side of the county to get vaccinated. So even though we can't fill that beautiful space, we wanted to get it open for people's convenience. We just have to believe that at some point we are going to get more vaccine. President Biden has taken very tangible steps to ramp up production of vaccine, and he has stated clearly that more vaccine will be coming to the states soon. And we just want to demonstrate that we are open and ready. As soon as that vaccine comes, we are ready to take it and start putting it into arms.
Thank you so much.
Our next reporter will be Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioners. First question, has the county been informed from the state? Have you received any more information about potential PEMA sites in the region that could be coming in the future? And has the regional officials, have they proposed, I think you were going to propose two possible sites for the region, for instance, Montgomery County and Bucks County and Montgomery County and Chester County. Have those proposals been submitted to the state, and have you heard anything back from the state?
We have no confirmation on any PEMA site. And additionally, today on a County Commissioners Association of Pennsylvania, a CCAP phone call, and our Department of Public Safety Director also heard this on a separate call earlier this morning. It was shared with the county commissioners that the 200,000 doses a week of Johnson & Johnson that the state had been told they were going to receive has been cut substantially. And that number is something like 65,000 now, approximately. I'm not sure that's the exact number, but there has been apparently a significant decrease in the amount of Johnson & Johnson vaccine that Pennsylvania will be receiving next week. I have absolutely no idea how that is going to impact all of these other plans. That has not been shared with us.
All right, but has the group of county officials in the Southeast region recommended sites for potential PEMA sites? Have you been more specific with the state regarding that?
The Montgomery County Department of Public Safety did recommend a site or two, I think two actually, to PEMA. It is up to them to vet those sites for appropriateness for their particular setup. I remind you that this will be a PEMA-run site, not a county-run site.
Okay, are you at liberty to say what those two sites would be, what you've recommended?
I'm not, because nothing's been confirmed at this point.
Okay, one final question. Are you aware of any glitches in the county's pre-registration system where people are being skipped over? I've received some concerns from some citizens who said that they were pre-registered and they were pre-registered with other family members, and some family members got appointments for the vaccines and others did not, and so now they fear they have been skipped over. What can those people do if they fear they have been skipped over?
Yeah, so the first thing they should do is carefully check their spam folder. We are hearing that oftentimes these appointment invitations end up in people's spam folders, so that's where I would always start. And then if they're in a situation like you describe and there's no sign that they got an email, they can either call that hotline number or they can email covid19@montcopa.org with their name, their date of birth, the day that they registered, and just explain the situation. And I can just reassure people that if somehow your email just disappeared into thin air, you will not lose your place on the line. If we got to you and somehow we just didn't connect with you, we will make sure you get an appointment. You will not have to go to the back of the line.
Okay, thank you. That's all I had today.
Thank you, Carl.
Next, we'll go back to Bill Anderson from Fox 29.
Hey guys, sorry about that. I'm also out here at the new site, and I hear the kind of hope that the state will provide more vaccinations. But as we've talked to people, what do you say to them, or what do you want us in the media to explain to people who are frustrated as they watch surrounding areas in Philadelphia get through 1B and have people walk up in their 1A and kind of working on hope? Right? What do we tell them to look out for or to remain encouraged, because they're asking the question?
Well, you can tell them that I'm really frustrated too. And as is, I don't want to speak for Commissioner Lawrence, but we are incredibly frustrated. We have conveyed as clearly as we possibly can to the Pennsylvania Department of Health that we believe we have been shortchanged on vaccines and that we have more than abundant capacity to give vaccines, and we are just waiting for those doses. So I just ask people to be patient. As soon as we get it, we will make it available. It is the one piece of this that is out of our control. I would just also remind folks that the rules in Philadelphia are quite different than the rules in the rest of the state. And so, for instance, in Philadelphia's 1A eligibility, you had to be 70 years old or older. Here in Mako and the rest of the state, 1A included people that are 65 years of age and older. So our number of individuals in Montgomery County that qualified in 1A, by our best guess, was at least 250,000 people, and that did not count all the healthcare workers. That was just individuals. So our 1A group here was quite large, which is why it's just taking so long to move through it between the individuals and the many healthcare workers that live in our county.
I just want to add that it's unfortunate that it's become the Hunger Games for this vaccination process. We are very frustrated by it, but hopefully as vaccine production ramps up, we are ready and willing and able to vaccinate our citizens. And it's unfortunate that some are waiting. It's unfortunate that some have had to travel to other counties or to other states. But as the vaccine supply increases and we get our fair share, we are ready, willing, and able to vaccinate our residents.
Thank you.
Next, we'll go to our communications director, Kelly Cofrancisco, with a question from Erin McCarthy from the Philadelphia Inquirer.
Thanks, Todd. This question is for Commissioner Arkush. Erin wanted to get your thoughts on House Bill 63, which would give the collar counties control of the mass sites and require the state to send out plans for sending more doses to the region.
I have not had a chance to read the legislation myself, but as we have been saying for weeks and as we have conveyed to the Pennsylvania Department of Health, we would welcome the vaccine doses to be given to the county health department. We are set up in certain places because we know that people can get to those places. And we are also set up with mobile units to get doses to people who are not able to get to one of our mass vaccination sites. So we would welcome those doses being given to us. That is what we planned for. That is what we've drilled for. This is how this was supposed to go. That's why we're standing here ready. We just need the vaccine. So I think just generally I would support that concept, not having read the legislation yet myself.
Thanks. That was her only question.
Okay.
We do have just a few minutes remaining, so we will allow for one follow-up question each from our reporters. I'll call on you in the same order as we did in the first round. We'll start with Jim Melwart from KYW.
I was going to ask something else, but there's a very diplomatic tone to what you're saying, but the things that you're saying, the single dose, Johnson & Johnson possibly being misused, the county plans being ignored, county capacity being ignored, just if you could remove that thin veneer of diplomacy and voice, you're saying frustrated, but it sounds like you're angry. Where are you with all this?
I've been very clear where I'm at. We are ready. We have done everything that this county was asked to do to be ready to respond to a public health emergency requiring mass vaccination. And we are looking for our partner, the Pennsylvania Department of Health, who controls all of the vaccine allocation to this county, to join us, to actually be our partner and let us do our part of this work. They need to get us more vaccine.
Next, we'll go to Deanna Durante from NBC 10.
Well, more vaccine could come in the form of that Johnson & Johnson that you're saying 200,000 doses is what the state was expecting, and now they're saying 65,000 doses. It seems like kind of a waste for them to set up a standalone clinic if they're not going to be able to deliver that 2,000 to 6,000 per dose per day that they were promising. So have there been communications with the state to say, okay, scrap those plans, send that our way?
I have not, I don't believe the state has made any plans yet, but you'd have to ask them. We have not gotten any communication about what the next steps are going to look like.
I will ask. I'm not certain I'll get an answer. Thank you.
We'll ask our remaining reporters if they have any additional follow-ups since we haven't heard from them yet. We'll start with Bill Anderson from Fox 29.
No, guys, I'm good. Thank you very much. I appreciate it.
Thanks, Bill. And finally, Alicia Reed from CBS 3.
I'm good. Thank you so much.
Thank you. That concludes our questions for today, Commissioner.
Great. Thank you. See you all next week.